All right, how you doing? My name is Isaiah Chu. I'm a student physical therapist here at Rocky Mountain University. Today I'm going to be demonstrating on how to use estim, specifically biphasic. So some indications on why we would be using biphasic estim is to increase range of motion, neuromuscular reeducation, reduction of muscle spasms, and just to decrease pain. Some regional contraindications include the lumbar or abdominal area if you're pregnant, any of the reproductive areas near the phrenic nerve, or near active infections or hemorrhage. Some absolute contraindications include active cancer, active DVTs, if the patient has any type of pacemaker, or if they have a history of epilepsy. So our patient today is Brandon. He's an 18-year-old who's 2 weeks out of ACL reconstruction on his right side. He's having trouble activating his quads, and he's showing an extensor lag during straight leg raises. His pain right now is pretty minimal. It's at a 1 out of 10. And today we're going to be using estim in order to help with quad strengthening and neuromuscular reeducation. So this is our patient, Brandon. How you doing, Brandon?
Good.
So you recently had a total ACL reconstruction on your right side. All right, how's it feeling right now?
Not too bad.
Okay.
Just weak.
Okay, so we done some prior testing. It says it looks like you have like a little bit of issue with extensor lag on your right side.
Yeah.
All right, perfect. So today we're going to be using estim. Have you ever used estim before?
Mm-hmm.
You have? Okay, so you're pretty familiar with me putting the pads on your quad and you contracting the muscle in order to fire it. Mm-hmm. All right, perfect. So the first thing we're going to do, we're going to inspect the skin. All right, everything looks good. You don't have any history of cancer or DVTs or anything, or epilepsy?
No.
All right, and you don't have any circulation or impairment issues where when I put my fingers on your quad, you could feel it?
Mm-hmm. Yeah, we're good.
All right, awesome. So I'm gonna turn, first thing I'm gonna do, I'm gonna put the pads on him. One right here. Perfect. So I'm going to turn this machine on. All right, we're going to be using biphasic. We're going to be doing a total of 10 minutes. The pulse duration is going to be 200 microseconds. Rate's going to be 50. And width and pulse duration is pretty much the same thing. We're going to be doing 200 microseconds. So I'm going to up the intensity just to a tolerable level by the patient. So I'm going to up it. Just tell me when you start feeling, Brandon. Oh, sorry. The duty cycle we're going to be using is a 1-to-3 ratio. So basically the machine is going to be on for 10 seconds and then we're going to be resting for 30 seconds. And the proposed mechanism of action we're going to be doing is, we're doing this because we're trying to fire the quad more effectively and just to implement some neuromuscular reeducation. The MVC is going to be 50 to 70%. So what that means is he's going to fire his quad at 50% of what his maximal is going to be. So like I said before, we're going to just up the intensity.
I'm starting to feel it.
Starting to feel it? Can you go up a little bit more?
No,
right.
keep going.
Or just tell me when to stop.
Still kind of tingling, probably getting there.
Okay. Just tell me when.
All right, that's fine.
Okay. So I'm going to start the machine. So before I start, I'm going to tell him just to raise his leg up, just to emulate that straight leg raise. All right, perfect. So raise your leg up for me and just contract. All right, perfect. So it's gonna go on for 10 seconds and then rest for 30 seconds. All right, so it's 30 seconds right now. Just give him a little bit of a break. How'd that feel? Everything feeling okay?
Yeah, it's just hard.
Okay.
Yeah.
Was your previous estim just pretty much like similar to this?
Mm-hmm.
All right, awesome. getting close. All right, raise that leg up. Perfect. Come on, man. Keep going. You got like 5 more seconds, dude. All right, awesome. So he's gonna rest for 30 seconds. You starting to feel it more, or?
Yeah.
Okay.
It's pretty hard to lift my leg up. It's pretty weak.
So it's been 2 reps. Ideally, we're gonna do this for about 10 minutes. So that'll be about 12 to 14 reps or so. So I'm gonna take this off. Oh, right here. Turn the machine off, and then I'm gonna inspect the skin afterwards. All right, perfect. Everything looks good. Can you still feel perfectly fine?
Yeah.
All right, awesome. And we'll start with the rest of physical therapy now.